Hey guys, so today I wanted to talk about causes of secondary hypertension. So blood pressure, high blood pressure can be classified into primary hypertension or essential hypertension, which is what the majority of people have, where there's no known cause of what's causing it other than genetic factors and salt intake and other generic things. And then there's another subset of population where what they have is called secondary hypertension, where there is a known cause of it. And this usually affects less than 10% of the population, and you don't generally test for this in people unless they have a risk factor or something persistent about it. For example, they've been on 3 or 4 high blood pressure medications and their blood pressure is still not being controlled, or they're super young and there's no family history of blood pressure. Then you have to, or any other red flags that come up, then you need to look for secondary hypertension. And so, what are common causes of secondary hypertension? First and foremost, you have to look at the kidneys. Chronic kidney disease is super important. You can check this by just checking a basic metabolic profile on the chemistry, looking at a creatinine and a BUN and getting an estimated GFR. Other causes of secondary hypertension include coarctation of the aorta. This can happen when the blood pressure is also not consistent with when you compare the upper extremity with the lower extremities. You do a CT angiogram to test for that. Cushing syndrome, most commonly due to excessive steroid therapy. These patients have a certain look to them. They can have stretch marks on their belly that are usually purple as opposed to other colors. You check the patient's you do a 24-hour urine collection for these patients to check for cortisol levels. Drug-related causes are also need to be ruled out in hypertension, and so you can do urine drug screen obviously for that. Pheochromocytoma, this is a tumor that releases catecholamines or norepinephrine. You can check 24-hour urine for catecholamines or metanephrine to rule that out. Family history is also important in these situations because people can have that MEN syndrome. Other causes, hyperaldosteronism. You can check a plasma aldosterone to renin level. You can also do a CT to look for a tumor on the adrenal glands. It's not as specific. Renovascular hypertension is more common, especially in younger patients. Younger females usually is something that you should definitely be considering. You can auscultate for a Brewy, but this is very non-specific, non-sensitive. It's very non-sensitive. You don't pick it up a lot of the time, especially with our decreasing clinical skills here in the United States, because we rely so much on imaging tests. So you can just do a Doppler study in this, a CT or an MR, angio. Sleep apnea is another cause of hypertension. You can do a sleep study. Thyroid dysfunction, so you can check a thyroid stimulating hormone level, TSH. And then primary parathyroidism, and you check out. You would see an elevated calcium level on a basic metabolic profile on a chemistry. So it's important that if you have one of these dysfunctions that you do the treatment specifically for them. Sometimes it's as simple as just medical management using an ACE or ARB inhibitor, and other times you might do something more invasive. Just quick overview of some of the more common causes. And this is not an exhaustive case. There are other cases as well. For example, thinking off the top of my head, the adult polycystic kidney disease, I believe also causes secondary hypertension as well. Okay, thanks for watching. Thanks. Bye.